All right, everybody. I just started the recording. So if you don't wish to participate in a recorded line, we will be posting this recording to the webpage that I'm displaying now, the SAP Business Technology Platform Garage. We also post the recordings to YouTube. So we've got a growing playlist from the last 5 months. Hopefully you're in the right place for a garage session. We really appreciate you attending this live session. So today's session, I will get started with in a moment, is talking about SAP Analytics Cloud. And our two presenters, Cameron and Sally, are the ones who created the mission where you can use Analytics Cloud in the context of healthcare enterprise planning. What we try and do on the garage, if this is your first time, is each month we pick a mission from the SAP Discovery Center, and we seek to bring it to life by bringing on subject matter experts like Cameron and Sally. The idea is not to go through each mission step by step, because some missions are very in-depth. So we try and bring you the highlights, try and give you the inspiration to get started with the mission. And so, yeah, we're really excited to bring you this mission. And next month, you can see that we'll be talking about intelligent RPA, and we'll announce the December session very shortly. So I'll stop sharing, and I will be handing it over to Sally, who is Senior Director of Innovation and Customer Experience. Cameron is from our business development team in the platform advisory team. Both are in T&I under the COO organization. So both are, intelligent and expert speakers that we're delighted to bring to you today. So Sally, thank you so much, and I'll hand it over to you.
Great, thank you, Chris, and welcome everybody. Good morning, good afternoon, wherever you are in your part of the world. So we are excited to talk with you about one of the use cases, as we think of it, that we have built that is now in the Discovery Center. And I also want to give a shout out. So Cameron and I did not build this on our own. So from the design side, there were 3 other designers who worked on this project, and from the engineering side, it was Cameron and Jim. So I want to make sure we recognize the full team here. And another note, sometimes because we had this question before regarding SAC, and because the name is capacity planning, thinking that this has to do with SAC planning, and this we are not using SAC planning. And we'll get into what capacity planning is in the medical or hospital setting. Okay, now, okay, it's advancing now. All right, so what are we gonna do during our time together? We're going to start out maybe a little differently than some of your other sessions. We're going to be starting out talking about the design side. So before you get into building, what happens on the design side? How do you come up with that design? So we will be talking about human-centered innovation and design. Then we'll go into the application realization diagram, or ARD. We'll go into the Discovery Center mission, and then we'll have a walkthrough of the dashboards. It's actually several different, 5 to be exact, 5 dashboards, and we'll conclude with a Q&A session. So let's talk about design. So the SAP human-centered approach to innovation, the process that we use, and this isn't just the particular team or organization that Cameron and I are a part of, this is across SAP. So we use a process where the steps are explore, discover, design, deliver, and then run and scale. So in explore, this is where you're identifying and prioritizing your innovation use cases. Once you select the use case that you want to focus on, and then we move to discover. And in discover, this is where you're developing a deep understanding of the problem and empathy for your users of your product or process. And the way we do this is with user research. So user research is key for developing that empathy. And then based on the knowledge that we gain and that deep understanding, we move into design. And design is where we design and create the solution or a solution prototype. Once we get, or with the approval of the prototype, we move to deliver. And deliver is where we build the system for your production system. And then after the solution is validated in your production environment, we move to the final step, which is run and scale. And this is where we're deploying the solution across your company, because commonly in the deliver stage, we've picked, one geography or one location where we are building it or implementing it in a production system. So in our case, for this particular project, the explore, what was the use case? So we selected a use case having to do with healthcare, and it's a use case around helping healthcare providers. They have a need to efficiently manage hospital capacity in the medical setting or in hospitals. And this is commonly referred to as the census or patient census. So this is looking at a hospital has a set number of total beds available. How many patients are in beds? And this is essential for hospitals to do, and especially during the uncertain times. So there were many hospitals, unfortunately, during since COVID and since the pandemic, that experienced situations where, particularly for their ICU, they were at capacity, which meant that even if another patient was coming in and needing a bed, they unfortunately did not have a bed available for that patient. So when we're looking at census, we are looking at the admissions, the discharges, and the transfers for both the emergency department and then the inpatient hospital. So that was our use case that we identified in Explore. Then we needed to move to Discover. And in Discover, I mentioned that we developed that empathy by user research. Before COVID, we were primarily doing all of our user research in person. And then with COVID, not just our user research, all of our steps that I just walked you through, we had to move to a remote process. However, with COVID, one of the challenges that we faced, because our scenario was in the hospital, or our use case was in the hospital, is that hospitals were operating in what they refer to as, crisis mode. This wasn't just, hey, we're really busy. Even in an ordinary time, we are in a crisis because of the overwhelming and the overflowing of patients into hospitals. And so we pretty quickly realized, even knocking on a number of doors for various healthcare customers, SAP healthcare customers, that we were not going to be able to get access to these end users just because of capacity reasons, that they did not have time to even talk with us. So then it's like, what's the next best alternatives? So we think of proxies. And in our case, we ended up interviewing some SAP partners who are working in the healthcare space. And we also interviewed some of our healthcare IBU colleagues to learn about the persona, to learn about the use case. Based on those interviews, we created what we refer to as low fidelity designs. So these are not built in SAC. These are sketches with various sketching tools, but these are sketches that help us have a conversation around what we believe or what we think at that point in time the design could look like. So we created these low fidelity designs, and then we went back to those stakeholders, and we went to the partners to get feedback. And overall, what we heard was there was good content in it. They liked some of the charts, some of the information. However, overall, they felt like the persona wasn't clear. They felt like the designs didn't fully match our story. And they questioned some of the charts, they said we may have some trouble actually getting that data. And this is, it wasn't a complete mess, but just the fact that we couldn't interview our target user, we couldn't interview our persona, we felt like this was a huge contributing factor for where we needed to really go back. And so what we did, we went back and said, all right, let's sort of start over. Who's our persona? Who are we trying to build for? And in this case, our persona for the use case was what we refer to as the chief nursing officer, or the person in charge of nursing operations at a hospital healthcare facility. So we created a persona definition. Then I also wrote what we refer to as user stories. What are we trying to build for? And then we had the team, everyone sign off on. So at least we're in agreement from that use case and story perspective. What do we need to design for? Once we had the sign off on the persona and the user stories, then we went back to begin design explorations again. And so this, at the time, with our first designs, we had 4 dashboards. Ultimately, we ended up adding a 5th dashboard. We pulled some, in particular, it was the staffing content, and created a whole dashboard with the staffing, because that content was spread throughout the other various dashboards. So we did some design exploration, continued to iterate on the designs and get feedback. And then ultimately that became these are our high fidelity designs. As I mentioned, there's actually one more dashboard. I know these are small, but just wanted to give you a taste of the dashboards that are part of our healthcare enterprise capacity planning. And we'll be walking through these dashboards later. So just a couple highlights. So these dashboards help to provide insight into the overall capacity or census at a hospital. So looking again, I mentioned at the admissions, discharges, and transfers for both that emergency department and in the inpatient hospital. It also allows a healthcare provider to look into, what's happening in the emergency department, because what's happening in the emergency department, this is often your doorway into the inpatient hospital. So you need to understand how full you are and what type of patients, or what are the diagnosis of the patients that are in that emergency department, and how many of those are going to be needing beds in your hospital, and do you have those beds available? And then I mentioned the staffing. So this is for the nursing staffing. So many states have actually laws around what they call nurse-patient ratios. So you want to understand, based on the number of patients you have, do we have sufficient nurses? Are we sufficiently staffed? Because it's a problem if you're overstaffed. It's also a problem if you're understaffed. So they need to understand the relationship between the two. And so being able to take a look and seeing how we're doing on our nursing staffing. All right, and with that, I'm going to hand it over to Cameron, who's going to walk us through the ARD and also the Discovery Center mission.
Thank you, Sally. I'm going to begin by sharing my screen. All right. Okay, so as Sally mentioned, the Healthcare Enterprise Capacity Planning dashboard is basically a template to envision your healthcare or healthcare-related analytics. It's really a starting point for you to begin your healthcare capacity related analytical scenarios. And basically, we initiated this project as a result of the global pandemic, because we understood that there was a need to manage or help manage critical care and staffing requirements in hospitals and the healthcare industry. So we wanted to help with that for now and for the future. And so with the design iterations and the mock-ups that Sally and her team originally came up with, we were able to have a guide into what we will be building out and eventually did build out, which the result was the Healthcare Enterprise Capacity Planning Dashboard that lives in the Business Content Network in SAP Analytics Cloud. And obviously, SAP Analytics Cloud was the obvious choice as part of the Business Technology Platform portfolio, which is one of the 4 pillars of the Business Technology Platform portfolio. And BTP, Business Technology Platform, is the foundation on which the SAP technology stack lays upon. So once we identified, the solution, the application, we knew the need, we understood the requirements, we began building and trying to create the dashboard and the requirements. So I will jump into the Discovery Center and the Discovery Center mission. So once you are into SAP Discovery Center, it's a free resource available to you. You should simply go into the missions. A simple refresh, I think, will do this. But you have a choice of various categories related to different use cases and different solutions. In this case, we are interested in analytics. You can look into the different, basically, missions and use cases available. In this case, we're going to go into optimize healthcare enterprise capacity planning with SAP Analytics Cloud. So first off, what is required here? Obviously, you can start the mission, but if you to be able to utilize this dashboard and this template, and to eventually include your own data as well and create your own models, we highly encourage you to have an SAP Analytics Cloud account, an environment. If you don't have so, please talk to your account executive. But to basically execute this mission and to enable yourself, you will need a SAP Analytics Cloud environment and tenant. So this is the overview page, which basically gives you a detailed view of what was the challenge that we wanted to solve and what challenge does this solve, and what this could potentially help you with and how you can enable yourself with this mission. I'll also go over the ARD, which is the application realization diagram, and it kind of shows the architecture, which you have the business technology platform on the left on one side, which is mainly SAP Analytics Cloud, and the business content network that lives in SAP Analytics Cloud. It's basically a library of various templates, a myriad of choices that you can basically start any of your application or analytics scenarios. And on the right, we have your on-premise or database layer from either your on-prem or hybrid scenario or cloud data center, and how you can basically connect that live or through via flat files to your SAP Analytics Cloud environment. So this is kind of the overview architecture that you can see here. With that, I'll go into the project board. I know Aaron briefly mentioned that we don't go through the steps here, but I will showcase the dashboard itself and go through how you can basically import and the content that is available in the business content network. But I just wanted to, since it's quite simple, I want to go over the steps as well, just to showcase how you can enable yourself, basically. So I'm going to view my mission since I've already started this mission. As you can see, the progress is 100. But if you go into the project board, you will see the various cards and steps which will take you into utilizing this dashboard that we have created, the Healthcare Enterprise Capacity Planning Dashboard. So this is the overview. The first card is the overview and related material, and the prerequisites for this mission. as I mentioned, you would want a tenant for your SAP Analytics Cloud, and just basic understanding of SAP Analytics Cloud as well. So now we want to into the dashboard and access, first of all, find and access the dashboard that has been created through all the hard work of the team, and how you can basically import that into your environment. So I'll quickly go over these steps. So this is my tenant environment in SAC. Once you log in, you'll have this welcome page. So you have this first page, and you'll see the list of icons on the left-hand side. Down here on the left, you'll have an icon for the content network. It looks like a book with a bookmark, so it's quite easy to find. And as you'll see, you have the business content here, pre-built industry and line of business content. So as you'll see shortly, there's a list of, this is basically a library of content, a pre-built content to start your analytical scenarios for various industries, line of business. But we today are particularly interested in healthcare enterprise capacity planning. You can either scroll through the library in the various pages, or you can simply search on the search bar here. So I'm going to put health, and we have healthcare enterprise capacity planning. So once you see the content of your choice, you have some high-level details of the content itself. And you can simply import that into your environment. I've already imported it. We had a session last night, so as well. So this is a warning sign. When you have imported, it provides you with a notification. So as you can see, I previously imported this successfully, and later when I re-attempted to import it, it gave me a warning simply saying that the content already exists. So I will. So that is another feature of SAC. It provides you the details so you can go into the import summary if there are any issues or any warnings that SAP will give you. But otherwise, you should get a basically success tick mark. So with that, I'm going to jump into my library. So once you've downloaded and imported the content, it should show into your SAP content folder. You should see a models folder as well, but I'm going to jump into the content. And as you can see here, we have the SAP HC Enterprise Capacity Planning folder, which the story that has been built and imported into my environment is available. So now, as Sally showed, basically the designs of this dashboard, now you have available the live version. But what I mean by live is these are data that exist within models and into the story. In SAC, as I showed in the application realization diagram, you can connect your own data source to SAC. But in this case, since this content already lives in Business Content Network, these are based on pre-built models that are static, based on static data. And we generated those data from the research that we looked into for this industry and this use case particularly, and generated some sample data to showcase for showcase purposes here. And also for you to kind of be able to interact with as your starting point, if for you to create your own models or input your own data. So as Sally showed, there are 5 pages here. We have the overview page, ED arrivals, emergency department arrivals, ED, hospital inpatient, and staffing. So here you get the overview of all the main KPIs, as well as the graph, charts, and heat maps of what would be important for someone in the healthcare or hospital to utilize for their analytical scenario. Or just get an overview of their main KPIs that they want to monitor so they can plan not for just today, but also tomorrow for any staffing requirements or critical capacity requirements. So I'll go into the various pages. So the second page, we also have the ED arrivals, the main KPIs. You have some time series charts, some graphs based on, for example, inflows by service line. These are broken down into number of patients by service line, so internal medicine, for example, emergency, and an arrival wait time, for example, a time series chart that could be useful, and turnaround discharge time. So we really looked into these various data sets, data points, because we wanted to understand what is important for someone in the healthcare industry or in a hospital. What would be important to them to see, and what will be useful for them to plan for the future, or just understand their current status. I think one of the things we looked into was board of patients. As Sally would tell you, this is an important KPI because you want to get this number in the hospital as low as possible. So the next page is the emergency department, and these are all KPIs related to the emergency department. Again, we have time series charts, graphs based on occupancy, wait time, turnaround discharge times, board of patients over time, and wait time over time. Now, another cool feature, just from the stories here, is these time series charts. So as you can see, part of the dashboard is part of the dashboard and the time series chart is highlighted in a solid color, but the rest is highlighted in a dotted line, basically. So what that is showing us is there's some predictive analysis going on here. I can dive into that a little bit more, but later. But this kind of shows you one of the cool features of SAC. Actually, why not? Let me just do it right now. So this is probably going to skip a few steps of the Discovery Center mission, but we'll go back to that. So in your SAP Analytics Cloud, you have the ability to edit the stories, the charts and the graphs. So this chart, and the important feature here, each chart, graph, or KPI is connected to a source in a model. So you can check here, what is the source that this graph is connected to? In this case, is the SAP HCCP service times model. But the one I want to show you here is that this graph, this time series chart, is showing you admission date for September and October. That is the filters that we have applied to showcase for this time series. But as you can see, the dotted line is showcasing data for November. So SAP Analytics Cloud is basically saying, looking into the data that is available for September and October, and creating some predictive analysis into the month of November. So this could be, something that could be useful for someone in the healthcare who wants to, plan ahead of time, or just have some, insight into some predictive analytics for a future date. But maybe I skipped a few steps here. So I'll go back to the Discovery Center mission. So we have gone through this step. We have access to the dashboard. Oh, and by the way, when you are importing your dashboard, you will get a notification in your notification center about the status of your import. And obviously, once it's successful, you will have it in your library, and as well a notification on that. And a tick mark, obviously, into either if it was a warning, if there was any needed to be made within your library, issues with the import, but otherwise you would have a success check mark. So now we want to confirm and test the models and the stories. So in this case, we're going to now check the models and see if they are currently working with the story. So that is the check we want to have. So I am going to go into my models folder. So I'm already in there. So I will look into service times. So this content or this template comes with two models and basically in a model, I personally like to look into this table view. So you have the various views here. So you can see how the different dimensions are working together to create this one model and the data points and data sets available that are being utilized in the story. So here quickly on the right, you can glance, see the data source again, which is the service times. In the middle of the table, basically shows you how the different dimensions, the columns, the column titles, and the measures are working together in creating that data set. So the account measures, which is for us, is for this dashboard, is the account service times, is basically the measures or the values or which we are trying to measure by, or what are basically what we are trying to measure here in this model or dashboard. So in this case, it was important to measure patients, wait time, length of stay, turnaround time, and diagnosis and arrival to service time. So once you have your member IDs, descriptions, things the line items which you want to measure by, you can then include some formulas or aggregations into basically your account. One cool feature about SAC is exception aggregation. You can see here there's some exception aggregation for average. Some of you who work with SQL will know that exception aggregation basically says that if to calculate and measure, what dimension should I measure by? So for example, if we want to calculate patient exception aggregation, I want to average that. I want to average patients by department. I can say exception aggregation by exception aggregation dimension. So patient numbers over departments. Basically, what that means is if we have about 100 patients and we have 5 departments, I would put in exception aggregation average and I'll include department as the dimension. And so that will give us about 20. So yeah, so that would basically say that there's an average of 20 patients per department. So you can see here those calculations are already being made, applied to some of the measures or some of the line items that we want to measure in this model and story. But the other thing I wanted to get into is the dimensions. So now that we know what we're essentially measuring, but what are the dimensions that we want to include into our model? So one of the things, as you probably saw in the story or in the dashboard itself, was departments. So we knew that these measures, these values, these metrics were important to include into and KPIs into the dashboard. So we have departments which have a member ID associated to them and a description, but also some values here as well. So far, this model, we can see that the model has valuable data that is also, we briefly saw in the dashboard. So now let's see if basically the model and the stories are working together. So basically, the numbers are reflected in there. And as I mentioned earlier, you can manipulate these data to fit either your own metrics or KPIs. Or you can upload or connect to your own data source to create your own models for this story. This is essentially a template, your starting point for what is required or what fits your need. So I'm going to go back to the story and essentially find a graph or a chart that is connected to SAP HCCP service times. So let me go to the overview page. So once I click on designer, I'll be able to see this data source for this chart here. And I see this is HCCP service times. So now to check, and also one of the steps in the Discovery Center mission, I want to check if I manipulate anything in the model, it will be reflected into the story as well. So let's say I'm going to change emergency department to ED. I'm going to save that. All right. Go back in my story. And hopefully we should see a reflection into this change in the story. So I'm going to refresh the story. Okay, so we see that change. So the model and the story are connected and they're working. So that was a success. And so let's go to one of the next steps. So let's see, we have test data, which basically tells us that once you have your stories and models imported, you want to make sure that the story and model are working. So I think we briefly did that, but why not? Let's go over one of the numbers into the models and see if we change that, if it will be reflected into the dashboard. So I have this census and nurses staffed over time. So I'm going to see what this is connected to. So this is connected to the HCCP census staffing model. So then I'll go back into my model folder, CP census staffing. And right now we have, for example, 920 for max occupancy. So I'll go in one of my dimensions and into department. And I'll change emergency department to 100. All right, we have this model is successfully saved. Then I'll go into my story, refresh. And this again should reflect some change into the story as well. So there we have it. We went from 920 to 870. So again, this is how you can check the models are working and the stories are working, and basically to test your data and test your stories and make sure it's successfully working together. So once you've done that, now again, I probably jump through a couple of steps, but then you will be able to view your story, utilize the dashboards, and also the various pages, the various KPIs, charts and graphs. And so create your own models, upload your own files, CSV and Excel, or connect your own data source to include into your healthcare related analytics dashboard. So this was the hard work of the team at App House, as well as the engineering excellence at PAA and SCE. So with the help of my colleague, we were able to create this together. But one challenge we did face during this project was now that we knew what we wanted to create, we knew what was needed for us for demonstration purposes. We needed to generate the data. Because we needed a large amount of data sets or data points to include in this dashboard. So the challenge was this was becoming a highly manual task, because it would be rows upon rows into a file in this case, to then create a model based on that. So what we did was, the solution, as any challenge will bring about, is a solution and a learning opportunity. So this is where we came up with the data to value generator, basically sample data generator, to demonstrate not only the capability of SAC, but have some values and KPIs that we can showcase for this purpose. So that resulted in writing a script, creating some code, and basically aligning some dimensions and values into our files, and then mapping that into, uploading that into SAC and mapping that to the dimensions and the measures that we wanted to correlate to and showcase. So as a result, there was a GitHub repository created, and you can access. So if you simply install Node.js, or if you have, based on whether you're on Microsoft or on a Mac, I believe on Microsoft is a command prompt, and in Mac it's terminal. You can simply utilize you can clone the GitHub repository that was created and download the files, the input and output files that were created, and either create your own or manipulate to create your own sample data set. If you like to demonstrate, for example, some data sets or KPIs for your demo or your dashboard, however you may like. But this is another resource available to you. So if you simply type in the code here, to simply copy and paste. But to make sure, I think in Windows, you have to make sure that git clone is available. And on Windows specifically, if you don't have git clone, you would just simply download the latest git release for Windows. But in this case, it works. So I would simply copy paste this code, and for me, it's already exists. As you can see here, it already exists. So I would write here. This will give you, once you execute the code in this step of the mission, you will have a file in a location on your basically computer environment, which will give you the different files that we were able to create those dimensions and measures and calculations towards. So if I go into, for example, the Analytics Cloud, it would be the Analytics Cloud Data Generator folder. And part of this package, what you will see here is the code that was generated that you can utilize for creating the sample data set. I think the one requirement that you, just kind of as a footnote or disclaimer, is to make sure if you're using Node.js that Math.js is available to you. But let me just go through the model here, and I'm going to show you how, basically just on a high level, how the model that we have, how that was mapped to the files, or how the files were mapped to the model. So currently I'm in SAP HCAI census staffing. So as part of the cloning, you will see that you have an input and output folder. you want to look into the input folder, and you can see based on the 2 models that we have in the dashboard, we have basically 2 files for each model. In this case, it's census staffing. But if you look at the census, if we look at the census field staffing fields, you can see this is basically just the column headers. These are the department, service, census dates, census day of the week. These were the dimensions reflected that you can see here in the SAC dashboard. Because one important also feature, or I guess requirement of SAC, is the data that is inputted within SAC needs to be consistent and clean. It's kind of like coding. Basically, to work, for it to work well, the source of the data has to be in a consistent and clean manner that can be showcase your data in the manner that you would like, or you wanted to basically showcase. So if I go into the census staffing dimensions folder, again, I'm just going to give a brief overview for this because for us, this was for demonstration purposes, but nonetheless, I think this is actually a cool thing that you can do and that you can work with to generate your own sample data if you need to. So we created some values within department and service. We have different sheets based on the census date, census hour. But for example, one of the values you wanted to create and data sets that we needed for the heat maps within, for example, this dashboard, because in a heat map, there's three values that is currently utilized. If we go into a time series chart, it's date over, for example, number of max occupancy. But in a heat map, you need a number of patients, which are the values here. You have the hours of the day, but also the day of the week. So that's where we can see, for example, if I go into here, we have census date, which is assigned a date of the week to every day in the year of 2021. And then from that, we have the census hour. So these are the hours of the day broken down into the values from 0 to 23. So basically what this is a Cartesian product that then the model will be able to, the sample data generator will be able to populate based on the value and calculations you give it. And lastly, we have some calculations here in terms of, for example, if we're looking into nurses, we have, as Sally mentioned, there's a certain nurse to patient ratio, and one of the researches that we looked into. So we created a min and a max for the measure of nurses, and we created a ratio. And if the integer is true or false, that's where you can input decimals or include decimals as well. But this is where we kind of included the numbers and calculations to then which we were able to, by running the script, creating the sample data for this model. So that is the last step of this mission. So as you can see here, if you simply, you'll be able to have the documentation for creating the input directory and output directory. So once you will have, I believe, successfully completed this mission and started your journey for your healthcare and healthcare related analytical scenarios. So with that, I want to thank you all for your time. And this was particularly enjoyable, a great project that I worked on and we worked on here just as a small contribution during this time. So with that, I want to give that back to Sally.
All right, thanks, Cameron. And in the chat, I dropped a link to this mission. Hopefully you are inspired to go and check it out. If you haven't already, we definitely encourage you to do that. I also put a link into a blog article when the data generator was made available, there was a blog written and put that in, so you can certainly check that out. Definitely, that helped us over one of the big challenges was building that, which was, we didn't have the data. Once we figured out what we wanted from a design perspective, we struggled with not having realistic medical data and we couldn't get data sets from a hospital due to privacy. It's patient medical data. So we couldn't get data sets. And so trying to build your own is a very large and cumbersome task. And we did attempt that. And unfortunately, that left us with charts that were confusing and in some cases distracting because of the data or the lack of the medical data that we needed in there. So the data generator was what enabled us ultimately to build these dashboards and have them show with realistic or representative medical data. So definitely encourage you to check out that data generator. And certainly we want to open up. I didn't see any questions in chat, so floor's open for any questions.
Sally, I had a question for you. This is Chris, obviously. If somebody was listening today and they're not in healthcare, right? They're in a different industry. Would you say this mission would be helpful in terms of just getting familiar with how to work with data sets? Or what would be a recommendation for a different industry or use case?
I'll let Cameron tackle that one first. I can give my thoughts, but Cameron, what's your thought being closer to the technical and data side?
So yeah, the Business Content Network has a library, it is a library of various templates and dashboards. So depending on your industry and your needs, you can simply look into all the dashboards available, all the content available in Business Content Network that fit your needs.
Yeah, I think this is a great question and interesting. If you're not familiar with SAC, it's an opportunity to learn about SAC. You do not have to build these the dashboards. We've already invested all of the research and done the design and then built it for you. So it gives you a chance to learn SAC and get familiar with it without having to build those dashboards from scratch. So that is definitely something that's transferable regardless of which industry that you're in. And even the data generator, obviously we were using this to generate medical data, but it doesn't have to be, it doesn't know whether this is medical data or construction data or whatever industry you're in. So that would be something that is relevant regardless of what industry you're in. So yeah. Great question there. Others? Let's see.
Well, I was going to
ask, to your point, Sally, I included the link to the GitHub, which is also available in the blog post that Sally posted, but that will give you all the instructions on how to create your own sample data generator.
I was going to ask, obviously,
valuable.
Yeah, today was sort of a highlights, but how much time do you think is needed start to finish for the mission?
I would say it shouldn't probably take more than 15 to 20 minutes.
Wow, okay.
That's probably highballing it.
All right.
It's quite simple, and it's a great way to enable yourself into your starting point for, yeah.
I would have said a little bit more than 15 to 20 minutes, just because we are familiar with the models and knowing how to quickly test. And Cameron did walk through the importance of after you import the data, making sure you have your connection between your models and your stories. But that being said, you're looking at a very small amount of time compared to what we invested from start to finish, from once we kicked off to this project till we had the dashboards built and then we were releasing it.
Any questions from the audience? You can do it through the chat, or you can unmute your line, I think.
Yeah,
Quiet.
I want one question. This is Andres Rincon. All the data that was generated, I mean, it is data that in a customer that will come from what kind of sources? I mean, do you have any chance to see if that data come from any particular solution in the health market?
So in the healthcare market, most, well, in the US, there are laws around what the healthcare data, and they have a medical record system. In many, or the large company in that space is known as Epic, and so that's where all the medical data or patient data is kept. So in the ARD, we just had a box for, we weren't calling out any particular product, but that would be where you would be pulling your medical data for, if I understood the question correctly, but I may have not.
Yeah, that was my question. Thank you.
Yeah. So it would be whatever system the healthcare provider uses for their medical records.
And from a slightly technical perspective, depending on your environment, you can either connect to your data source, or you can, if you have files, then you can upload those files to create your own models, include those into the dashboard.
Thanks for the question. Any other questions out there? Okay, well, thank you everybody for attending today. Thank you, Cameron and Sally. That was really interesting. And like I said earlier, we will be back next month, first Wednesday of every month. We do a garage series, and the next session is going to be on RPA on November 3rd. So thank you, everybody. Really appreciate your participation today.
Great.
Thank you, Chris.
Everyone. Bye.